So tell me a little bit more about your guys' lab services. So you started out doing COVID only. So now you guys have expanded those services. Are you, and I don't even know what the right term is. Are you a full service lab now, or what kind of tests are you offering now?
Yes. So we are essentially a full services laboratory. We do a lot of tests in-house, a lot of the basic tests, the CBC, a CMP, thyroid tests, diabetes, anemia, things like that. We can do most of those things in-house. We do have a reference laboratory. So if it's a test we don't run in-house, we can send it out and have it tested.
And we still do the cash pay up front, and exactly how much it is.
Yeah, we do that even for the test we send out, because we have a price that we can get that done at a reference lab. We charge and actually for send out tests, we don't even add a fee on top of it. We just charge them exactly what the reference lab charges us. So we feel like that's more than fair. We do charge, to draw blood and then to do the testing in house, but we're trying to provide as low cost of service as we can, because we just feel like people deserve that. Now, as you can, we haven't really talked about the name of our company, and maybe I could talk a little bit about that, because that tells you a little bit about what we do and what we plan on doing. Tomorrow's Health, we came up with that name because we want to get into preventive health. So this idea that, and this goes to encouraging customers, patients, to be more in charge of their own health.
Yeah.
And a lot of that is prevention. What can I do in my life to prevent bad health consequences in the future? So that's why we called ourselves Tomorrow's Health. What can we do today,
right,
to make tomorrow's health better? And so, the direct to consumer, the ability to monitor things like hemoglobin A1C or our sugar levels in our blood, or monitor a PSA to look at our prostate, to be able to monitor things to prevent disease or to mitigate the effects of
that's our
disease.
Goal.
That's our goal, is preventive health. And we are going to, in the future, get into, hopefully, genomics, human genetics.
Yep, that's coming.
Looking at people's medical history, and providing people with plans. And as part of that plan is you do lab testing, you do screening. Yeah. And if you think about how much money you save, even just money, but obviously more important is quality of life. But even money, if you can catch cancer, for example, any kind of cancer early,
saves a lot of
you're going to be able to treat it. You're going to have a better quality of life, and it saves a lot of money. Doing lab tests to screen for different cancers is so much cheaper than treating cancer if it's third and fourth stage. And then, of course, you can die from it. You can have a really low quality of life with that. So,
and it's amazing that blood does not lie. I mean, sometimes blood is moment, but it's honest. Like, I didn't really understand that before we started doing this. And I was like, oh, your blood tests are very, very good at looking at where you are in that moment and helping you track over time what you're doing and if it's working for your body.
For sure.
And it's amazing. We have a lot of clients now that are coming in from gyms, like fitness centers, because they're trying to figure out what is their hormones doing.
Absolutely.
And if you're using for example, to get hormones, you need to know what effect is it having on you. So it works in conjunction with a blood lab in order to figure out, is this working? Is my body responding? Am I going to get the benefit of optimal hormone balancing? Can I find that? Yes, you can.
And a lot of times in medicine, people get treatment, it's a lot of it's empirical,
Right.
where, a doctor might say, well, let's treat you with this, and this might help. And a lot of times they'll say, we'll have you do some tests in 3 months.
Right.
Why 3 months? Why not do a test in 2 weeks and then one in a month? And you're just because in some cases it's useful to do that. Well, you can only do that if it's affordable.
Exactly. I was just going to say it's affordability.
Yeah.
And that's, I think, that's why we've got, and doctors, I think most doctors know that if I could do lab tests a little more often, I could get a better picture of my patient.
Yeah.
But then they realize that it costs so much to do lab testings, billing through insurance, that they're like, well, I'm not going to make you do that, even though it's better.
Right.
And so it's not affordable, but it's better. And so, and there's been all of these cost analyses looking at lab testing, and saying, well, we shouldn't do this testing this often because it costs too much money. Well, and so then you say, well, but is it better? Well, it is better for certain things to test more often, but it's too expensive. Well, then let's figure that out.
Right.
Well, one of the solutions is let's do a cash pay model where it's cheap and you don't bill through insurance and the patient can order it themselves. It doesn't have to come through the doctor even. And then they can get a lot of different data points that helps the doctor understand what their health really is.
Absolutely.